Our number one goal is to establish nasal breathing. The nose is where it's at when it comes to breathing. The mouth has nothing to do. And again, with Chris Evans, I was talking about, like, what is in our mouth? And our teeth are in our mouth, our hard palate, our soft palate, the back of the throat, our tongue is in it, our gums. And what do any of those functions serve inside the mouth? It's not for breathing. Our teeth, hard palate, soft palate, tongue, gums do nothing for breathing. It's for talking, it's for eating, it's for drinking. And the only part of the body that serves any purpose in terms of the breath is the nose. And the nose has so much going on. Dr. Morris Cottle, back in the 1970s, he said that the human nose has 30 functions. I couldn't find them, you know. So I started putting a list together myself, and I put 30 functions of the importance of nose breathing. Some of it is kind of memory improves with nasal breathing, attention improves with nasal breathing. We select our partners based on the communication from the nose to the brain, similar to an animal. Of course, human beings were, you know, one could say that we are animals too, to some degree. Our sense of taste, smell, you know, and even behavior as a result of the sense of smell. When we breathe through our nose, we've got 10% increased oxygen transfer from the lungs to the blood. Like, that alone should be enough to encourage people to breathe in and out through the nose. When we breathe through the nose, there's a resistance imposed by breathing during the day. So by breathing through the nose, it's adding a resistance to our breathing that's putting an extra load onto the diaphragm to help maintain the function and strength of the diaphragm. And of course, the diaphragm breathing muscle isn't just for breathing, but it's also for posture and for spinal stabilization. And the number of people who have come in over the years saying that they suffered from lower back pain, and only when they started breathing in and out through their nose that their lower back pain started to become alleviated. And I was always interested with that. And I remember writing a book a couple of years ago that I was doing a deep dive into the biomechanics of breathing and the influence that it does have in providing stabilization of the spine. That with every breath that we are taking, it changes pressure. You know, there's a negative pressure in the chest during inspiration, but there's a positive pressure in the abdomen. And all of that movement of the diaphragm with every breath, you know, the number of breaths that we have, if it's 12, 14 breaths per minute, 60 minutes per day, 24 hours per day, we're talking about probably upwards, maybe 15, 20,000 breaths per day. Every one of those breaths has a function in terms of lymphatic drainage, massaging the internal organs, increasing venous return blood flow back to the heart, the connection between the diaphragm and the mind. And people have talked about that. You know, the instruction to take a deep breath is correct, but the interpretation is often incorrect because people take this full big breath. So, Caroline, yeah, the nose has a lot of functions. And so one would ask then, why has it not got the attention it deserves? It's so simple. And there's no money to be made from it. You know, if you ask somebody, if I show somebody a nose unblocking exercise, you can show somebody how to decongest a nose in 5 minutes. You don't need medication.